Which part of the pipette? Just say stem of the pipette or the bulb. Stem of the pipette. So if you have to mention stem of the pipette, you have to mention part of the stem which is above the bulb, because usually by stem of the pipette we mean the lower part conventionally, because although the whole part is the stem, the bulb is not in the middle but somewhere near the upper part of the stem. But why do we mean one part? Just to conventionally, why do we mean? Because in the procedure we have to discard that blood up to fluid. After taking into the pipette, when the blood and the fluid is mixed inside the bulb, the lower part is the part of the fluid in the lower part is discarded. That does not contain any blood, so that it is not charged. Okay, only the blood and fluid mixture will be charged. That is the reason we call it conventionally the stem of the pipette as the part of the stem which is lower than the bulb. But actually the whole thing should be called the stem, but as we call it conventionally the stem, the lower part. So when you mention about this 101 marking, you say in the upper part of the stem at least, or more specifically, and all these things will not be written in books. You have to apply your common sense. What is the most better answer? That above the bulb there is the marking. Only one marking above the bulb, that is 101 in case of RBC pipette, 11 in case of WBC pipette. But did you hear her answer? Her answer did you hear? How to identify the RBC pipette? So first line she told was there is the presence of the red bead. Do you want to modify anything? Answer wrong, no. Do you want to modify anything in this answer? Yes, red bead is present in the bulb. Modify means, yes. WBC pipette, diameter or size. So that should be the first line. That should be the first line. Why? You did not mention this point, size of the bulb, but that should be the first point. Do not mention the color. I'll suggest do not mention the color, because we have told that red bead, this red color may fade with time. The answer is not wrong, but that should not be mentioned at least at the first point. First point should be that the size of the bulb, when we compare the two pipettes, obviously the size of the bulb is greater. In some authors are writing, or some these practical textbooks only, they are writing the stem of the, again by stem they are meaning the lower part below the bulb. Stem of the RBC pipette is narrower and the stem of the WBC pipette is larger, but at least in my eyes it has appeared. It is difficult to make out, especially just by looking at, not very difficult, but leave that point. But at least the size of the bulb when we compare the two pipettes, and obviously after knowing the whole theoretical portion about this, how to charge, calculation and all, you see if the size of the bulb is not larger, how will it, the bulb and that upper part, small upper part of the stem hold 100 times blood, 100 times of any fluid. It may not, if we charge the pipette with water. So the volume of that part is 100 times the lower part. But in case of WBC pipette, it is only 10 times. So that can only happen, this discrepancy can only happen if the size, other than the size of the bulb. When can it happen? If the bore of this lower part of the stem is considerably, it is narrow or wide, but it is not that considerably. It may be somewhat, the RBC pipette is somewhat narrower, but that does not, by looking at it, can you identify that much narrower or much wider? No. So mainly that difference lies in the size of the bulb, and obviously it can be made out. Size of the bulb in the RBC pipette is greater than the much means it's approximately say 8 to 10 times. So, but much means, but it can be made out with the naked eye, commonly with our this naked eye is our vision. So that is the main point to be mentioned. If when the examiner will ask you how do you identify this, that this was the RBC pipette, and another is the marking 101. Again the marking also may fade out. So without these points the dilution factor will be varied. If we work with the WBC pipette for RBCs, the dilution I am thinking in my mind that the dilution, I have made the dilution 100 times, but actually it is, or 200 times, rather 200 times, 101 minus 1 by 0.5. If we take blood up to 1, then blood up to 1, then the dilution will become 100 times, but cells will be difficult to count. Mathematically, the result will be same. If we think of this mathematics, the arithmetic calculation result will come same. If we consider we have diluted the bulb 100 times, we have counted the cells, the result will be same. What it will be, the dilution factor will be 100, and instead of the calculation part we have done, what it comes? Please study and come to the class. If you have studied, okay, I will try to interact, then try to interact. Anybody? How is it calculated? What is the size of the RBC squares? First, how many types of RBC squares? Types, or not just types, it is not classified, it is divisions. The central RBC square is, the central RBC square, think of the whole counting grid, 4 corner squares are WBC squares, central one is the RBC squares, and 4 squares in between 2 WBC squares are, there are 4 such squares. In between the left upper, right upper square is the upper non-counting square, then one left non-counting square, one lower non-counting square. These are not counting squares, these are only triple lines passed through them, and those triple lines are dividing what? Before that, this is divided into, if this is the central RBC square, this is divided into, sorry, yes, 5. I am sorry, this looks odd because this does no more looks like a square. Just consider it a square. I am drawing with the hand. So if this is 1 mm, this is 1 mm. 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. So 25, not 16, 25. 16 will be, so the triple lines will divide each of these, say these, all these into 4 into 4, 16. Okay. So from here the calculation, volume of blood, as you have done in WBCs, that's why we did WBC first. The number of divisions of squares is less, and the calculation is the calculation part, the theoretical part is a bit easier or a bit simpler to understand. That's why we have done WBC first. Now we will be doing RBCs. So if it is, in case of WBCs, what we have seen, we are counting the cells in 1 mm into 1 mm square. Altogether, WBC counts are less, dilution requires only, say, these 20 times. Okay. Even I think, that is my opinion, don't take my opinion, because the experiments have been done in the labs, the standard methods have come out. But my opinion is, we count the cells very easily in case of WBCs, in the whole square. Few cells. Even if we by mistake take blood up to 1, or if not by mistake, deliberately take blood up to 1, the dilution will be 10 times. Cells lying in that same area of those squares, there will be more number of cells, and it will look somewhat more congested. It should not be called congested, it will not look very congested because WBC cells are few. In the same area, there will be more number of cells. If the dilution is less, this is just common sense again. In the same area, in this same area, if the dilution is less, then there will be proportionately to the fluid, that is in case of WBC Turk's fluid, this is the RBC square, this is the WBC square. So this is 1, 2, 3, 4, 1, 2, 3, 4. So 4 into 4, 16, this is 1 mm into 1 mm. In any case, be it RBCs, WBCs, whatever, if the dilution of the blood is less, that means proportionately blood is more than the fluid. So in this same area, considering uniform distribution, whenever we charge the blood, that is again a very important step, because blood has to be uniformly distributed in the counting grids. That we are assuming. But practically, when we are doing hands-on, especially as beginners or who are doing it after a long time, what happens? If charging in is appropriate, then say blood comes into these 4, 5 squares, but not charging will not be uniform. But if that is done correctly, assuming this, what will happen? If the charging is uniform, then as the dilution is less, more number of cells will be there. If blood is not diluted, a lot of cells will be there because that will become the count. Think like that way. If we have not diluted the blood, then whatever those figures we are getting 50x, or in case of WBC, this, what is the calculation in WBC? 4 such squares are counted. So each square is this area, each square millimeter. And what we have told, although this is written in books, volume of the squares, don't say volume of the squares, because squares are on a 2-dimensional surface. Like we told, floor of the room cannot be a volume, roof of the room cannot be a volume, it can be an area. But yes, floor of the room, but the whole room there can be a volume as there is a height. So what is that height here, the third dimension for calculating volume? Yes, the space between the grid and the cover slip, so that is 1/10. So when we have charged blood uniformly, after charging of blood, this is the volume of the blood, that is 1/10 millimeter. This is the volume of the blood overlying the squares in 1 WBC square. So do you get it, everybody? Is 1 WBC square? So if you can't understand, still already we have done WBC, then please tell. Then volume of the blood in 4 is 2/5 millimeter cube. We are counting cells. Say this is the left upper WBC square, we will name this as, say, x1. x1 is equal to, or x left upper is equal to some x in left upper is equal to so many cells. Then capital X is x1 plus x2 plus x3 plus x4. So that 2/5 millimeter cube contains x number of WBCs. So 1 millimeter cube, but this is diluted blood. This is diluted blood. This is 5x/2 number of cells in diluted blood. So for undiluted blood, this into the dilution factor. Okay. So if we count without diluting blood, then what will happen? Actually this x will come more. This 5x/2 is the answer. So this x number of cells without diluting will be more. It will be, in case of WBCs, maybe it won't be that congested, but still it will be congested without any type of dilution. If it is dilution is 10 times only, then the final answer will be, say we have taken blood up to 1 and then taken fluid, then dilution will be 11 minus 1/1, because blood is 1 portion. So it is 10 times. So the final calculation is, it will come like 25x, but actually that x is then double of what is by diluting 20 times. Have you got it? So why do you dilute it that 20 times? So the answer for the reason for dilution is counting it properly. Otherwise, if there are so many cells, and it happened yesterday during counting of RBCs in your groups, this group C batch, because the dilution was not being done properly. So there were so many cells, that cells were not possible to count. In 3 or 4 of them, the 3 or 4 of the microscopes, all the squares were just lying, everything was the RBC cells. So for counting, there should be number of cells so that they are possible to count practically. If I keep say 5 marbles on this table, it can be counted. If I keep 20, it can be counted. If I keep 100, I think it can still be counted. But if I keep 1 million marbles on this table, then it won't be possible to count them. And especially if they are looking the same, okay? If there are 100,000 marbles, each of different colors, then still it is possible to segregate. Whatever we are looking under the microscope, everything is looking the same. Even after proper charging, okay, the cells are looking very, that means by the term nice, if I say nice, I mean that structurally, okay, we can identify these are the RBCs, but they are so huge in number without proper dilution that they are not possible to count them. So that's why that part is very important, proper dilution. And has been standardized that please do it like that we dilute it 20 times for WBCs and 200 times for RBCs. That is, don't take blood more than 0.5 and don't take less also. So you can say, so to count cells I will take blood up to 0.1, then will it contain much cells? No, maybe so many few cells. So if it is 0.1, okay, again theoretically 101 minus 1 by 0.1 is the dilution. But actually what is happening, most of it is actually the fluid and very little blood. So again that is not very suitable, as counts are, if we could count cells in a more volume of blood, maybe the count would be more appropriate, accuracy would be more, if only we could make it practicable. So we have to understand that there should be a balance. It should be practicable. It is not possible to count, say, cells in 10 ml of blood, so many cells to count humanly. So it should be practicable as well as much as accurate. That is what I have done in bleeding time also. In bleeding time we said, if we take the interval to be, say, 3 seconds, then the time would be more accurate. We can say it is the bleeding time is such and such, 2 minute, say 63 seconds, 1 minute, that will be 3 minute 3 seconds or 3 minute 18 seconds. But humanly it won't be possible to take blood drops after 3 seconds, and it would require a much larger area of filter paper and all. Okay, so conventionally it is 30 seconds, okay, 15 seconds is okay, 10 seconds is still okay. More you decrease the interval, the more accurate it will get, but it has to be practical. In what is the case in case of RBCs? What will be the calculation like? So this is 1 millimeter into 1 millimeter square. In case of RBCs, it is actually this. So RBCs has two types of division. WBC has two types of divisions: large WBC square, small WBC square. In case of RBCs, it is large one. These are medium ones, 25, and each of these is divided by those triple lines into this. So these are the smallest ones or small ones. In the books, it is written small, medium, smallest. Don't confuse yourselves. Write large, medium, small. RBCs 3 types of squares: large, medium, small. In books it is written smallest. So smallest is obviously smallest, but we can say large, medium, small. So medium RBC squares, even it will not be possible practically it will take huge time to count all the 25. So we count the left upper medium, right upper medium, right lower medium, left lower medium, and central medium sized square. Okay, left upper, and we do conventionally we do it in this direction. You can do it in any direction. Now we can say why this left upper and left. If we have to count 5 out of 25, we can count any 5. Then it will give us the answer result. So why these 4 corner and 1 central of the medium squares? Again apply some sense. Not that the count is uniform, we are considering uniform distribution. So if it is uniformly, if it is uniformly distributed, it should be that whatever is the density of cells in a corner would be the density of cells in the central. Again, if it is not uniform, then say cells are restricted to this area. So that means I have not done the charging uniformly. So the charging should be uniform so that my accuracy is better, and to that, just to corroborate that, I am assuming this is uniform, so I will find cells like that. Okay, left upper, it should not be that in left upper corner square I get 300 cells, but in the right lower corner square there is only 20 cells. So we are considering that we are doing the experiment to make the result as accurate as possible. So we are charging blood uniformly. So during counting, we are considering the corner squares. If we have to count 5, we have to do like this. Okay, if we have to count 20 cells, then you may say 120, leave out any 5. But if you have to count 5 cells, then the 4 corner, that is the reason, the 4 corner squares and the central square, that counting 5 is sufficient. More you can count, more accurate is the answer. If we can count all the RBCs in the body, we will get the most accurate answer that so many RBCs are present in my body, present in a human body, but it is not possible. So here we have to make it as accurate as possible, but we have to also make it practicable. That is why counting 5 cells in the 4 corner squares and the central square. Now, what is the calculation part? Okay, before that there is some points which are to be, which is, I think if you have read the books, then you already know how to count this left upper square. In case of RBC, cells will be more in number. So, like WBCs, it is not possible to count this whole cell. Even it is not possible one medium size square together. Again, same thing, this marble over the table. If we try to count all together, then it will make errors. So, the small squares, small RBC squares, or what is written as smallest squares in books, that square, these squares are counted separately. So, 16 counted separately, right. By counting these 16, we write it as, say, if it is say x1, that is, this is x1, okay. Again, this inside this 16 counted separately. And how? Density of cells are more. Cells will not be lying only on the, in case of WBCs also, cells won't be lying only inside the squares. Squares are made for the purpose of our convenience, the human eyes convenience. So, cells will lie on the margins also. What may happen is that number of cells are so small, so many in case of RBCs. So, cells will lie inside a square, small square, medium square, whatever. Cells will lie inside a square and also on margins. Now, suppose I count this cell. Conventionally, we do it from left upper to others. In case of this one, we will go from left upper, right upper like this, 5 squares. In case of counting this 16, we will count 1, 2, 3, 4, 5, 6, 7, 8 like this up to 16 squares. So, we conventionally start from left upper, we can start anywhere, we have to count all these squares. That I have to remember, to again not to confuse ourselves. We start it from left upper and we suppose end counting those 16, 4, then 4, and this should be focused under in a single field. That is why we use 40x, okay. It is possible to more or less take a single field under 40x, because more will be the magnification, less will be the field area. If you do it 100x, it will reduce. If you do it 10x, then it will be more. So, that is, so by taking 40x or 45x, it is a single field. So, we are counting 1, 2, 3, 4 like this. So, counting these cells will be lying on the margins as well. Suppose I count 1, 2, 3, 4, 5, 6, 7, 8. But when we will count the second cell, there is a chance that these cells on this margin, the common margin, will be counted twice. So, what is followed is that a rule called the rule of L, which is mentioned as the rule of L, that when we count cell number, say 1, cell number 1 means, cell number 1, square number 1. Here we refer to the cell. Squares can be also termed cells mathematically, but here we are talking of cells as the human body cells, in this case the RBCs. So, tell them as squares. So, when I will count square number 1 of the small squares, the rule followed is these margins, which have, instead of red color, everything is erased. So, think of this. So, this margin is counted and the inside is counted. So, rule of L, because I am writing it as a L. So, this is the cell count of this particular cell. Then during this counting, we consider this margin. Now, this margin is not double counted. Okay. So, this rule of L, now this goes away, instead of red color, vanishing color. Now, again this L, okay, let it vanish. Let all these vanish. It will be more easier to understand, I think. So, this is a boon in disguise. Everything is vanishing, vanishing, vanishing. So, see, actually we have counted this whole thing. Okay, and what we have counted this. Okay. So, what is left out? This margin and this margin of the medium square. Count it at the last. I think in books it is not mentioned. Okay, that count it at the last. It will be more accurate actually. Few cells will be in this margin of the medium square also. So, more cells you count, more accurate is the answer. So, cells will be there in here also. So, count it at the last and mark it as x1. This x1 is the of the left upper square, or you can write x left upper, whatever. So, but if you write x1 in answer scripts, write like this, mention what is x1. x1 is the number of cells in the left upper medium square, or x left upper also. These are not standard terms. So, whatever you write, that has to be explained. So, this is the method by following the rule of L. We count the right and the upper margins at the last in case of every such square. Now, how do we come to the squares? From the left upper, once we identify the left upper square, triple lines on the left, triple lines on the over, and RBC squares on the other two sides. Then we move 3 cells, we get the right upper one, and we confirm it by that there will be triple lines over here on the right and upper side. Then come down, after counting we come down, and it is similar. We confirm by moving just 3, going 3 cells, 3 actually 4, that means leaving 3 similar cells. If we go to the next one, that 4th cell is the another corner, but we will confirm it by seeing the triple lines on these 2 sides. Again here also. So, by this method we identify the cells and complete our counting, and then the calculation part. After completing the counting, capital X is x1 plus x2 plus x3 plus x4 plus x5. So, now the calculation part, how many cells we have counted? How many medium cells we have counted? 5. Each of them has an area of, this is 1 by 5, this is 1 by 5 millimeter square. So, the volume is volume of, not strictly speaking not the squares, but the volume of the blood overlying the squares, because this 1 by 10 is the as if the height of the blood, that is in the space between the cover slip and the squares. So, it is 1 by 250 millimeter cube. This is the volume of the blood overlying 1 medium square. So, volume of blood overlying 5 medium squares is this one, 1 by 50 millimeter cube. Now, this contains x number of cells. So, 1 by 50 millimeter cube of blood contains, 1 millimeter cube of blood contains 50x number of cells. This is easy elementary mathematics. X by 1 by 50, that is 50x. Now, consider the blood was not diluted. If this is diluted blood, if the blood was not diluted, this my x would be the answer. So, mathematically it is possible, but that x would not be possible to count. The cells will, what happened yesterday, cells were so congested that is not possible to count. So, dilution has to be done, and dilution has to be done in the standard figure which is given in books, because those they did the experiments and arrived at this, that this dilution factor is sufficient so that the count is practicable. So, this was 50x, so we have to multiply it by the dilution factor we have got. So, the answer will be 10,000 x, and put x at last and just mention the result. So, that is okay. If it is say x is say 523, then its result is 5.223 million per millimeter cube of blood. So, that is our answer. So, this is the difference, but one thing, okay, I should not have rubbed it off. Anyway, you will understand. If you have understood it up to this point, actually we are counting how many cells in RBCs? We are counting the medium squares. Actually, are we counting the medium squares altogether? The small squares. So, better to write it as, although this will be sufficient if you write like this, actually we are counting the the small squares, small square number 1, 2, 3, 4, 16. So, what is the area or what is the length of one small square? Small RBC square. Each small RBC square. 1 by 5, 1/4 of that 1 by 5, right? 1 by 20. So, what is the area? 1 by 20 millimeter square. So, what is the volume? Into volume of not squares, again volume of blood overlying the square. That is, this one is the volume of one small RBC square, or one smallest, if you call it smallest, then smallest RBC square. And we are counting how many smallest squares? 16 in one medium square. Yes, 16 in for one medium square. So, for 5 medium squares is this, and see this will again come to, it has to come, that is 4, this is 5. Is it? Have I made any mistake? Yes, 1 by 50. So don't memorize anything. I have not memorized anything. It's 1 by 50. It will come to 1 by 50. So I am counting this volume. Why it is better to write like this? Because I have actually counted so many squares. I have not counted only 5 medium squares. I have actually counted the inside 1680 squares. So it is better to, this is a better way to write. Answer will be same, obviously, the calculation will be same, but or the result will be the same, but it is better to write like this. But even if you don't write this, if you write it as 5 into 1 by 5 into 1 by 5 into 1 by 10, it's sufficient. But actually this is what is we are doing. We are counting so many squares, 80 small squares, and the area of volume of the blood overlying those 80 small squares is this one. Each of this is that. So for 85 into 1680 is this. So we are arriving at the result. So better way to write is this one. Like in better way, if you say, I have told you in bleeding time, if you say it's 3 minutes, okay, I have not got the 6th spot or I have not got the 7th spot, so it is 30 into 7, it's okay. But it's better to say that I have got the 6th spot but not got the 7th spot. So 30 into 6 is 180, 30 into 7 is 210. The result is somewhere between my bleeding time, the result is between 180 seconds and 210 seconds, or 3 minutes and 3 minute 30 seconds. That should be a better answer. If you take an interval of 15 seconds, it is between 2 minute 45 seconds and 3 minutes, because I never know that at which point it actually stopped. So that should be a better answer. Although it will be sufficient for you, it will be sufficient if you answer it like this, that it is 3 minutes, but it is better. Always Viva exam is, at least some part it is about what impression it creates on the mind of the examiner. So always try to answer it as well as possible, okay, not as good as possible, because sometimes that carries credit may not be in that particular question, but the examiner is a human being and humanly he or she thinks, okay, this student, so even if you, maybe if you can't answer 1 or 2 more questions, the examiner will still happy, and when just giving the credit, giving the score, that plays in his or her mind, okay, because you have at least answered 1 or 2 questions better than others. This happens, this is the examiner's mind is a human mind, no machine is evaluating. So that's why try to answer as good as possible. If you write like this 80 squares I have counted, I think it is a better answer, okay. What's the time now? Then I'll, okay. We'll just discuss about something called the RBC indices, because it is related to this, although we have not discussed anemia in the theoretical classes, we have to discuss that, but we will just hear RBC indices, it is possible to understand for whatever we have known till date. So, and that is mentioned in, if you see the, again I don't know whether you are doing, I am asking you repeatedly, go through CBME 2024. In this practical portion, this DOAP session, CD hemoglobin, whatever these topics, whichever we have done, one point is mentioned RBC indices, and questions won't be direct, that total are, in most cases, take the blood sample and do the total RBC count. Questions won't be direct, questions will be on these RBC indices, or questions whatever we are going to discuss right now. The question will be that you have to decide which experiment I have to do, okay. Questions will be like that. So what do we mean by the term indices, or what do we mean by the term index? Indices is just plural of index, the plural form of index. Index has different meanings. Index of a book, we will find at the end of the book, these topics have the books. So in this case, in quantitative measurements, index means the quantity, it indicates the quantity of something, okay. So index, RBC indices, some quantity, RBC means any index, or in that meaning of index is some quantity, literal meaning. So plural is indices. So by RBC indices we mean some parameters related to this red blood cell. So there are quite a few of them, but the clinically relevant ones, and if you think from your examination point of view, which are asked in the exam or which you have to perform yourself, you have to take out the result, they are 3 in number. There are a few more. Mean corpuscular volume. This class may be a bit extended, but we won't get time to do this separately, I think, because still now you don't know, but only this is January. You will have your exams in the month of September, I think. Nothing to write down, everything is in books. Whatever you need to write down may be not mentioned in textbooks. I'll ask you to, like you can, if you want to write down, you may write down that one single thing in your notebook that I will write in the exam, volume of blood overlying the squares. In book it is written volume of squares. Although it won't be wrong, but it is a better way to answer like this. Bleeding time, I'll answer between this point, between so many minutes, 3 minutes and 3 minutes 15 seconds. These things which are not usually written in books, you may write those down, but most things you don't need to write down. You have to follow any one textbook, practical textbook for this. So mean corpuscular volume, mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration are just 3 of the several, there are more indices, but these are clinically relevant and we use these. Clinically relevant means we classify anemia on the basis of this. Anemia has still not been discussed, that competency that will be discussed soon. So mean corpuscular volume, mean corpuscular hemoglobin concentration, usually even if not universally accepted, these are written, or you will face questions, the abbreviations will be given, MCV, MCH and MCHC. But the funny part is that whenever you are asked, you means the students are asked in the exam, what is MCV? The answer comes mean corpuscular volume. What is MCV means you have to explain the thing, not just tell the full form. Okay. So what is MCV? So MCV is mean corpuscular volume. So better to ask what is mean corpuscular volume. But whenever we ask, because these are more or less very accepted terms, so the examiners ask like this, tell me what is MCV, and just the answer comes mean corpuscular volume. So what is that? Nobody knows. Okay, so that should not be, you have to know what is this. So just what does mean mean here? Again, the term mean has different meanings. Here what it mean in relation to this quantity, mean means average. Usually it means the arithmetic average, okay, arithmetic average of anything. So the 30 students attend yesterday's class, 40 are attending today. If 20 attend tomorrow, then the average is 30 plus 20, 40 plus 20 by 3. That is arithmetical average. So mean corpuscular volume. What corpuscle we are talking about here? RBC. These are RBC indices. It is not written as mean RBC volume or something. It is written as mean corpuscular volume or mean red blood cell corpuscular volume. In this case, corpuscle means red blood cell. Mean corpuscular volume. Just the meaning will come from the term itself. Volume is volume, obviously volume of a cell, which is theoretically we know what is the diameter of RBC? Theoretically 7.2. Again, don't say, what did you say? 7.5, 7.2, 7.5. What? No. Point is that don't say pulse rate is 72. Say, those who are here, group B, who have joined just in January, have missed the earlier classes. You have joined in January? 6th January. Okay. So we have to take a note that I think there is no official document that we have joined so late. So we'll try to arrange these hematology classes. Everything is not possible to repeat, especially theoretical classes, but I have talked with the HOD, we will try to arrange some classes or at least some revision classes where we will do with the other, you have to do with the revision for others, but vision for you who have not first vision, the other topics, This is the last topic which you have to perform hands on in the exam, last of the hematological topics, and there have been some clinical topics have been discussed too. So pulse we have discussed, that's why this came to my mind just now as we have discussed pulse, blood pressure and all these things, general physical examination. So pulse rate, never say pulse rate it's 70, what is the theoretically accepted, never say it is 72. This was the answer from your school days, class 3rd standard answer, it's 60 to 100, normal pulse rate is 60 to 100. So most things there will be a range, it won't be a single number, if not all, most parameters. So it's 7.2 to 7.5, like this it is said, micrometer, this is theoretically accepted value. Now mean corpuscular volume of RBC, mean corpuscular volume means average volume of RBCs, that is in one way it is volume of a single RBCs, that is if we know the volume of say 10 RBCs, dividing it by 10, now everything human body, as I am going on telling, it is not 2 plus 2 4, like it is not simple mathematics that everything will not be 2 plus 2 4. So every RBC in the body is not if not 7.3 micrometer, it is not 7 micrometer, the range is there. So we speak of this thing called the mean volume, that is if we take 10 RBCs dividing it by 10, it will give me some value, that is the average volume of RBCs or the volume of a single RBC. We calculate it like that. If we know the volume of say 100 RBCs, again more number of RBCs we take, probably the accuracy will be more. If we take 2 RBCs, if they are say larger than the others, then that will not give me an accurate measure. But we will come across all these terms again in when you read PSM, this community medicine. What is mean, what is median, what is mode, how there is a bit of statistics. So statistical some methods you have to know in case of you go for medical research and all. So this is included in community medicine. So you will come across these terms. Mean means arithmetic average. So during how is the arithmetic average made more accurate? By taking more quantity to measure. If we say measure 100, measure the weight of 100 of quantities of the same thing, then dividing it by 100, the average will be nearer the actual reference range. If you take only 2 or 3, those may be greater than the others. If we speak of volume, taking only 2-3 RBCs, if all the 3 are much larger than the others, much means say it is 7.6 or 7.7 micrometer, but it is not near the average which may be like 7.3. Okay. So more quantities we take, more will be accurate be the answer. Again, how we do that? We consider one particular volume of blood. So more volume we take, I think more accurate will be the answer theoretically, but we may consider any volume of blood to be when we calculate it theoretically. Say we take 100 ml of blood, we consider volume of 100 ml of blood. So we have to know what is the volume of RBCs in those 100 ml of blood and what is the volume of a number of RBCs in that 100 ml of blood. Then dividing it, we will get the mean volume or volume of a single RBC. This is simple mathematics. We know the number of RBCs in that volume of blood, we know the volume of RBCs in that volume of blood. Okay, that is how we do it. We know volume of RBCs, number of RBCs by the volume of RBCs. So in 100 ml of blood, how much is the volume of RBCs? We have already mentioned it in hematology theory classes, although we have not discussed the topic here. So what is that called? Volume of the cells. What is the volume of blood cells in blood? That is called packed cell volume of hematocrit. What is the volume of blood cells in blood? It is how much percentage? Theoretically accepted value, what is the percentage? What is the volume of plasma? Again it has to be a range, it is not exactly 55 and 45, but it is say 50, around 52 to books are writing, some books are writing 52 to 60 like this is the volume of plasma, rest is cells. So if we have to calculate, we cannot take a range during just the calculation, we take usually it is 55% plasma, 45% cells. Now 45% cells include RBCs, WBCs and platelets, which are not actually, platelets are not actually whole cells, they are fragments, but conventionally we call these blood cells, the cellular elements of blood. So 45% includes RBCs, WBCs and platelets. But for practical discussions, as RBCs we know are much more huge in number than WBCs and platelets, more or less we consider maybe 45% as the number of RBCs during these types of calculations. These 45% are RBCs. Actually it is RBCs plus WBCs plus platelets. Maybe if 45% are RBCs, then total it will be 48-49% the cells. Okay, I am just mentioning some arbitrarily. During practically calculating these things, we take 45% is RBCs, but actually it is RBCs plus WBCs plus platelets. So in 100 ml of blood, what will be the volume of RBCs? Considering 45%, it is 45 ml, right? Don't try to memorize anything. I have also not memorized, we will just calculate. Now what is the number of RBCs in 100 ml of blood? So theoretically number of RBCs in blood is 1 microliter contains 4.5 to 5 million. So 1 microliter will contain 5 million. So it is 5 into, again for the purpose of calculation, we can't take a range, we have to calculate one single, so we take it to be 5 million, right, 5 into 10 to the power 6. So in 1 microliter, now ml is 10 to the power 3 times of microliter, just think, liter, 1 liter is 10 to the power 6 microliter. So 1 ml, that is equal to 10 to the power 3 microliter will contains 5 into 10 to the power 6 into 10 to the power 3 number of RBCs. Number of RBCs in this volume 1 ml. So in 100 ml, same as writing it as 10 to the power 2 ml, as we are writing it in power, it will be 5 into 10 to the power 6 into 10 to the power 3 into 10 to the power 2. By the rule of this calculation of these exponents, the rule is adding this up, it is 5 into 10 to the power 11 RBCs in 100 ml of blood. Remember, we may take any volume of blood. If we take it 1 ml, then this will be the number of RBCs in 1 ml, but then we have to take the volume of RBCs as 0.45 ml or 45 by 100 ml. Okay, if we take 1 ml of blood, the volume of RBCs is 45 by 100. Okay, we can take any volume of blood, 100 ml is a convenient figure. We are getting 5 into 10 to the power 11 and we are getting a figure 45, a whole number, not a decimal. Avoid decimals in calculations as much as possible. Do it in fractions. Whenever we can take the whole number, try to do it in fractions, not in decimals. That will lead to mistakes in calculations, human mind calculations. You don't have a calculator to help you, at least from the exam point of view. So if the 100 ml of blood contains this number of RBCs and the volume of those RBCs is 45 ml, then what is the volume of 1 RBC? It's 45 by this, right? So it's just note down the figures 45 and 5 into 10. Note down means you can do this yourself if you understand one. So it will be 45 by 5 into 10 to the power 11. And what is the unit? We have written 45 ml, 5 into 10 to the power 11 has no unit. So this is the unit, milliliter. Okay, this is the volume of 1 RBC, that is mean corpuscular volume, average volume of 1 RBC. This is 9 into 10 to the power minus 11 milliliter. Even if we leave your answer at this, you are correct. Okay. So understanding it as doing in this way, this is the volume of 1 RBC, this is the mean corpuscular volume, but usually accepted theoretical, what is the theoretical unit in which we express usually, like we can express hemoglobin in milligrams also. It will be 15,000, say 14 to 16 or whatever, say 15 grams. So it will be 15,000 milligrams. But to make it a convenient figure, we do it in grams. So theoretically accepted unit of measuring or expressing hemoglobin is grams. So theoretically accepted unit of writing this is in femtoliters. Femtoliters, femto, F-E-M-T-O, it is given in books, femtoliters, which is 1 femtoliter is 10 to the power minus 15 of a liter. This is the conversion. So we usually measure it in femtoliters, but actually this is the correct answer, this milliliter. To get a convenient figure which looks convenient to us, we measure it in, we theoretically accepted value is femtoliters, what is 10 to the power minus 15 liter. Now just convert, this will be 9 into 10 to the power minus 11 into 10 to the power minus 3 liters, right? Because 1 liter is 10 to the power 3 milliliter. Now if we convert it into femtoliters, we have to multiply it by 10 to the power 15, right? So 10 to the power minus 11 into 10 to the power minus 3 into 10 to the power 15 femtoliters, as it is the theoretically accepted unit. So it is minus 11 plus minus 3 is minus 14 plus 15 is 1, that is 10 to the power 1. So the answer is 90 femtoliters. Again, this we are taking 5 million RBCs, theoretically accepted value of MCV is 78 to 92 femtoliters. 78 to 92 is the range, okay, that is accepted range. If it is less than 78, we consider it is a small RBC. If it is greater than 92, we consider it is a large RBC. Femtoliters we can show in the CGS system, it will come to micrometer cube, okay. So instead of starting with microliter, 1 microliter is 1 millimeter cube. So we can arrive at that. 1 femtoliter is 1 micrometer cube. This can be shown. This can be shown means this is, there will be a system for SI to CGS conversion, that is 1 liter is equal to 1 decimeter cube. From that we can show that 1 femtoliter is 1 micrometer cube. If you want to show, it will take some time, but still let's show it. 1 liter is equal to 1 decimeter cube, okay. So we are trying to convert from the SI system to the CGS system. So 1 femtoliter is equal to 10 to the power minus 15 liter. Okay, this board is not, don't confuse, I'm trying to rub it, but this is the thing, that this ink is such that does not get rubbed off easily. In some cases it is not getting rubbed off easily, in some cases it is vanishing. So 1 femtoliter is 10 to the power minus 15 liters is equal to 10 to the power, this is the standard conversion. So it is 10 to the power minus 15 decimeter cube. It will be, and see, don't memorize anything, there is nothing to memorize, just take this cube here. So it will be 10 to the power minus 5 decimeter, that is 10 to the power minus 5 decimeter means it will be decimeter to, yes, decimeter to micrometer. See, 1 decimeter is 10 to the power 5 micrometer. Again think just that conversion, meter, decimeter, centimeter, millimeter, and micrometer is again 1000 times, that is 1 by 1000 of a millimeter. So from decimeter to micrometer is 10 to the power 5. So this can be written as 1 micrometer. So this is 1 of cube of 1 is 1. So femtoliter and micrometer cube is same thing. If we would start with, instead of microliter, if we start with millimeter cube, then the answer that 90 is in micrometer, if we calculate it in the CGS system, okay. So it is the theoretically accepted value of MCV is 78 to 92 femtoliters or 78 to 92 micrometer cube. It is the same thing, and during calculations don't go for decimals. In some books or some texts you may find it is calculated like this, things are written, figures are written in decimals, more chances to make mistakes, especially during the exam you won't have calculators. So, do it in fractions. So, MCV theoretically accepted value 78 to 92, this is written in books, and again what is written in books is that, written in books, I am not telling books are wrong, that is correctly written in books, that is if you go by formula, in my opinion, this is a, why I will explain why there is a chance to make mistakes. There is a simple formula, that is RBC count in millions, PCV by RBC count in millions into 10 femtoliter, or same thing is micrometer cube. So, what you have to put in the formula? PCV is 45, it will accepted value, we have taken it as 45, 5 millions into 10. Now write this down, PCV by RBC count in millions into 10, this is the formula, write that first. MCV formula is PCV by RBC count in millions into 10. Did you write the calculation without the formula, how you calculated it? Did you write that down? Okay. Now write PCV by RBC count in millions into 10, but I will ask you to write this down already, although given in books, and I will tell you why. Now write, it's, if we take it as 45 and 5 millions, 45% and 5 millions, it will be 45 by 5 into 10 to the power 6 into 10. So this is 9 and this is 10 to the power minus 6. So is it 90 femtoliter? No, but write it down first. Okay. Now make a big cross on this. Write it and then cut it, and that will remain in your notebook at least till your exams. Now write 45 into 5 by 10 femtoliters, it's 90 femtoliter, and give a big tick over it. Do this. Point is that when writing RBC count in millions, only the figure before the millions is to be written, not that 10 to the power 6. This is the commonest mistake in exams during using formula, and almost 70%, 60-70% students are making it during exams. It may be in objective structured practical exams, that the count of PCV count is given, RBC count is given, say instead of 5, it will be, say if it is given 6 million, you will get full credit if you write 45 by 6 into 10, because, or 45 by, say it is given 6.85 million or 5.83 million. So in the exam, in the objective structured questions, this time will be given 1 minute for each question. There will be a time, usually there is a timer. So 45.83 into 10, it would only be possible to calculate. Calculation is not required, logic is required. If you know the formula, you can put it. That is not exactly logic, but that is formula, but still, this is the accepted formula, you can put it. But if you put 10 to the power 6, the answer is wrong. If you write 45 by 5.83 into 10 femtoliter, answer is correct. Although the final figure is not arrived at, that is correct, because that is not possible to calculate, that especially in 1 minute, dividing 45 by 5.83. But still, in these types of mathematical questions, usually not 1 minute, it is 2 minutes. I will tell you that don't go by formula, because that is the mistake which one makes. In the exam, you are not coming prepared for MCV only. You are coming prepared for a lot of things, and in the head, it does not play like that. It becomes 5.83 into 10 to the power 6 if you are writing formula. I will tell you, do it in the unitary method, which we have just done. Nothing to memorize, no formula to memorize, just 5.83 million. Instead of 5 into 10 to the power 11, you will write 5.83 into 10 to the power 11. At the last, you don't have to calculate the final answer, you leave it at so many femtoliters. What will be it? In that calculation we are done, instead of, it will be 5.83 into 10 to the power minus 6 for the, in milliliter, taking 100 milliliter of blood, just convert milliliter to femtoliter, into 10 to the power minus 3 liters into 10 to the power 15, like that. Just convert and leave it at 45 into 45 by 5.83. It will be into 10 femtoliter. You will arrive at the same thing which the formula arrives at, but there is less chance to make mistakes, although this writing this calculation will say, just this unitary method, if you have the concept, it will say require 45 seconds. But the chances of making mistakes is less. But if you go by the formula, and if you put that 10 to the power minus 10 to the power 6 by mistake, the answer is wrong. So you won't get any credit, the answer becomes wrong. So it is always better to do it by concepts, not by memorizing formula, not by anything. Anything it is better to express by concepts, not just mug up and vomit it down, because there are chances making mistakes. In this case, you just see. And this will, even after telling this, those who are attending today's class during the exam, it is human to make mistakes, because you can't remember. You will just think this by this is in million, so I'll put 10 to the power 6. But no, if you have to put the formula, then without that million you have to put only the figure before the million. Okay. So this is how mean corpuscular volume is calculated. Mean corpuscular hemoglobin is the next RBC index we will talk about. That is the average mass or the mass of hemoglobin in a single RBC. Mean corpuscular hemoglobin. Again, it comes from the term average. Mean is average, corpuscular hemoglobin. So what is the amount of hemoglobin in an RBC? In one RBC. 1.56. What is 1.56? Any theoretical value? So hemoglobin is in grams. Hemoglobin is not in ml. Hemoglobin, it is a solid. We consider it. It is made from whatever we have studied. This protoporphyrin and all. It is in grams. So what is the theoretically accepted value of hemoglobin? That is in 100 milliliter of blood. But mean corpuscular hemoglobin, we are not saying in milliliters of blood. We are saying in one single RBC. So again, take 100 milliliter volume of blood. Okay, 100 milliliter volume of blood. So if we know the amount of hemoglobin in so many RBCs, say 10 RBCs, we can divide by the 10, and so that is the amount of hemoglobin is 1 RBC. So if we take 100 ml of blood, what is the theoretically accepted value of number of RBCs in that amount of blood? Again, it's 4.5 to 5.5, or it is 5 million, we say, for the purpose of calculation. 5 into 10 to the power 6. And what is the hemoglobin accepted value in 100 ml of blood? 12 to 16 or something like that. So just for learning for the first time, we take it a convenient value to be 15, just for calculation. So amount of hemoglobin in 100 ml of blood is 15 ml. Number of RBCs in the same amount of blood is 5 into 10 to the power 6. So the amount of hemoglobin in a single RBC is this one, and this is in 15 is in gram. So it is 3 into the power 10 to the power minus 6 gram, and this is the correct answer. Correct, mathematically correct answer is this, but again, to make a convenient figure, is it correct? 5 into 10 to the power 6 million of RBCs contain 15 gram of hemoglobin, right? 1 DL, no, sorry, we are wrong. Obviously, we are wrong. Why we are wrong? Why we are wrong? Yes, we have to convert it in 100 ml blood. 100 ml blood it is 10 to the power 11. We just calculated. That's why I did not show. But we are wrong. This is not the answer. So this is the. So it will be 5 into 10 to the power 11. 5 into 10 to the power 6 is in 1 microliter. So in 100 ml it will be into 1 microliter, then convert it into 1 milliliter and then 100 ml. It is 5 into 10 to the power 11. So it will be 5 into 10 to the power 11 and it's 5 into 10 to the power 11. So it was a mistake, and these mistakes, these types of mistakes happen in the exam if you don't do it conceptually. So it is 5 into 10 to the power 11, write like that, the volume of accept 5 into 10 to the, if it is given 5.83 or 5.6, you write 5.6 is the, or the volume of RBCs, number of RBCs is 1 microliter of blood is that. So in 1 milliliter you convert, 100 milliliter you convert. Now it is 3 into 10 to the power minus 11 gram. But the theoretically accepted unit to make it a convenient figure, what we use is picograms, and the conversion is 1 gram is 10 to the power 12 picogram, okay, or 1 picogram is 10 to the power minus 12 gram. So it is 10 to the power minus 11 into 10 to the power 12. So minus 11 and 12, it's 10 to the power 1. So the answer is 30 picograms. So 30 picograms is this by calculating, but again the values are, we have just considered for this 15 and 5, values will differ. Hemoglobin may be 12.3, this may be 5.83. You don't have to arrive at the final result, just multiply for gram to picogram conversion, multiply by 10 to the 12, no final figure to arrive at, just leave it at that. If we take it as say 15.7, if we take it as 5.8, so write 15.7 by, instead of 3, write 15.7 by 5.8 into 10 picograms, okay. That is the answer. So that is the hemoglobin in one single RBC or mean corpuscular hemoglobin. Again, formula is this, the formula is hemoglobin by RBC count in millions, RBC in millions per microliter into 10 picograms. But again you have to remember, you don't put into 10 to the power minus 10 to the power 6 here. So if you have to put it, it is 15 by 5 into 10, it's 30. If it is 15.8, it is 5.7, 15.8 by 5.7 into 10 picograms. But if you put 10 to the power 6 here, it is wrong. If you go by the formula, so it is better to calculate and conceptualize it and calculate. Then chances of mistakes are less. So this is MCH. Another is, which is clinically more relevant, it is MCHC or mean corpuscular hemoglobin concentration, which is defined as the amount of hemoglobin in a certain volume of RBCs, as or not certain volume, expressed as a percentage of volume of RBCs, not volume of blood. MCHCs definitions are given in all textbooks. Amount of hemoglobin expressed as a percentage of volume of RBCs, not volume of blood. Writing in volume of blood is totally wrong. MCHC definition, that is, what is, how do we calculate hemoglobin volume of blood? We are already expressing it, 15 gram per 100 ml of blood. So it is not in volume of blood, it is volume of RBCs. That means expressed as percentage, that is 15 ml, 15 gram of hemoglobin in 100 ml of blood, but what is the volume of RBCs in that? 45 ml. Okay. So it is just the percentage. Here we are not. So this is the, actually we will read about percentage saturations in other areas also. Percentage saturation of oxygen with hemoglobin. It is called, this term is called percentage saturation. how much of RBCs is saturated or how much of RBCs is filled with hemoglobin. So as volume of RBCs, so this is 15 by 45 into 100. It is, if we take these figures 15 and 45, it is easy, 1/3 into 100, that is 33.33%. Did I mention the range of the MCH? You should ask this question. I am always telling, answer 27 to 32 picograms is the theoretically accepted range for mean corpuscular hemoglobin. What we calculated as 30, theoretically accepted is 27 to 32. Okay, if it is 25, then hemoglobin, mean corpuscular hemoglobin is less than the reference range. The reference range is 27 to 32. For 33.33%, the reference range for MCH is 32 to 38%. Reference range, theoretically accepted reference range. If we take 15 and 45, obviously it may be something else. If we take the PCB to be say 40 instead of 45 as 48, and it may be anything, say 13.8, so it is 13.8 by 48 into 100. Now MCH is a better indicator. When we will discuss anemia, you will understand it better. MCH is a better indicator for this classifying anemia. We have not done classification of anemia till now. Why? It does not take into account the count of the RBCs. It is only the volume of the RBCs. Why not the count of the RBCs? It is a better, because count of RBCs we are doing by this method, which we will do in the lab just now. But there are other methods, automated methods that come up, but still there are chances of errors. Okay, chances of 15-20% errors when we try to count the RBCs, either manually or by method. So better to avoid this count of RBC. It is taking the mean corpuscular hemoglobin is taking into consideration both the size of the cell and the count. So if we can eliminate this count factor, it is not here, it is not taking into consideration count of RBCs, volume of RBCs. So taking the volume of the RBCs and expressing this hemoglobin, how much of hemoglobin fills the RBCs, volume of RBCs, it is always a better indicator, especially in classifying anemia, and we will do this classification. We will study about anemia in the next few days. Maybe in 2 weeks time we will discuss this in the theoretical classes. So 15 by 45 into 100, MCHC, explain why type of question comes, and we will discuss this, that why MCHC is a better indicator of, I have just mentioned it in short, for classifying anemia. MCHC better than the MCH. Mean corpuscular volume just gives me the size of the RBC cell, okay, and anemia is defined as the decrease in hemoglobin or RBC or both. So we will discuss about anemia. So, but 15 by 45, for now just remember MCH is a better indicator, and reasoning type of question may come in the exam as well. It is a better indicator than MCH for classifying anemia, or for classifying or for describing anemia. So another point to note over here, MCHC cannot be greater than, is usually not greater than 38%. It may be lesser, but usually not greater. Again, this is also a reasoning type of question. Why? MCHC usually, MCV may be, say we are speaking of 78 to 92, but it may be 100 femtoliters. That means the size of the RBC is large. That means we have large size RBCs, macrocytic RBCs those are called. When happens? During the maturation stage RBCs, we have talked about erythropoiesis already. So what is required for maturation of RBCs? Vitamin B12 and folic acid. When they are deficient, we had mentioned of the factors influencing erythropoiesis, nutritional factors. Two very important nutritional factors is, along with other vitamins, vitamin 12 and folic acid. So if these are deficient, then the size of the RBCs become large. That is called macrocytic anemia. And the counts are less, so we call it macrocytic. So those are macrocytic large RBCs. So a size of a RBC, average size may become 100 femtoliter instead of maybe 90 or like this 80-90. So size of RBCs may be greater, but MCHC is usually not 50%, or never 50%. Instead of 38, it may be 39, but the accepted value is 32 to 38. Why it is not 50%? Because the hemoglobin synthesizing machinery of the RBCs, or the machinery of the human body, that has a limited capacity. That cannot go on synthesizing hemoglobin to such a degree that the MCHC becomes 50%, and it is independent of the count of RBCs. So it is always a better indicator of all these parameters. Among these parameters, it is the best parameter probably clinically. So it cannot be, this is again a reasoning type of question, why hemoglobin MCHC cannot be in the range of say 45-50 or not range, yes range but figures. It does not usually get above a certain figure because hemoglobin cannot be synthesized in such great amounts that will saturate RBC to the extent of 50%. So that is maximum like this 38%, maybe 39, maximum 40, but not 50. 50 is an arbitrary figure I am mentioning about. That means MCHC can usually be lesser than the reference age, but it is not much greater than the reference age. In case of MCV, it can be greater. Size of RBCs increases, but not in case of MCHC. So these are the clinically relevant or clinically very important, significant RBC indices. From the purpose of practical exam, how is it important in the lab? You are given PCV and you are told to calculate MCV. You have to know that I have to, my experiment is total count of RBC. Nobody will mention do the total count of RBC. Nobody means, most questions will not be like that. You have to, PCV is given in the question, PCV you don't have to perform yourself. It is in your syllabus, if possible. Syllabus means just demonstration. You have to not perform hands-on. We will show you. Even if not, PCV will be mentioned in the question. MCV will be asked to calculate. So experiment you have to decide its total count of RBC. People are making mistakes. They are obviously they are doing some. If you do hemoglobin in that experiment, the whole thing becomes wrong. You cannot arrive at the result. What is the MCV? For MCH, either of hemoglobin of RBC will be mentioned in your theory. The value will be given in the question. A person's hemoglobin is this. MCH, you have to calculate MCH. So RBCs, you have to do the experiment. If RBC count is given in the question, you have to estimate hemoglobin by this Sahali's acid hematine method and take out MCH. For MCHC again, as you have to, don't have to do PCV hands-on. PCV will be given, and you know you have to, what you have to do is hemoglobin estimation. So from your examination point of view, here what PCV is not, you have to calculate. So if PCV is given and you are to calculate MCV, you have to do total count of RBC. If PCV is given, you have to calculate MCHC. It will be given in the question, calculate MCHC, you have to do hemoglobin estimation. If either of hemoglobin and RBC is given, you have to calculate the other for experimentally do the other for calculating MCH. Questions won't be direct, questions will be based on RBC indices for these topics. Okay. For WBCs, DLC also questions won't be direct. For DLC, it will be like total amount of WBCs is given, total amount of WBCs, total number of WBCs. So calculate the number of neutrophils, you have to do DLC and take that percentage. Say 65 neutrophils, you have counted 100. So in the result is 65 by 100 or 63 by 100 into what is given in the question, like that. So questions will be like this. Or before pipetting blood, you focus the squares. That is the first part. That means I just told up to pipetting blood it is same, but focus the RBC squares first. After taking blood, if you try to, so that the focus of the cell, focus of the microscope, just you put the slide under the microscope and you can calculate, or you can you can count. So first focus the RBC squares. Keep the focus, microscope focus there, and then you go for pipetting blood, taking blood and pipetting it and charging it. Keep the focus of the microscope ready so that you take out the Neubauer chamber, charge blood and all, again put it under the microscope, take the chamber, counting grid and first focus. Then when you focus after blood, you don't have to move the adjustment screws anymore, more or less. So first focus where you have to count, maybe the left upper square. So first you will be counting the left upper square. So keep that in, make the focus ready. You will just remove the chamber, charge the blood and then again put it, so that at that time finding the cells become easier after the blood has been charged. So first focus the left upper square. Where you will start? Left upper of the RBC squares, RBC medium sized RBC squares.